Let's have a look at the Treatment Toolkit and how it's put together. It contains several programs that can be used separately or in combination. To build these, we carried out a thorough search of the research literature to identify some of the most effective psychological treatment methods. We also looked at the same clinical guidelines that your doctor uses to make decisions and translated them into plain language. Plus, we dissected many of the best-selling self-help programs, including the workbooks that clinicians use for training. We then double-checked with one of the most trusted databases on the planet. It's the Cochrane Collaboration Library, where they look for evidence that's untainted by researcher bias, use standardized methods and measurements, and compare the actual size of treatment effects. We use this information to help break down best evidence methods into their component parts. Examples of programs in the toolkit include behavioral activation for depression, relaxation and mindfulness methods, cognitive strategies for problem thinking, cognitive behavioral treatment for insomnia, strategies for managing your anger, exposure-based tactics for addressing a wide variety of anxiety-related symptoms, and relapse prevention strategies for alcohol and substance abuse problems. The toolkit is built so that you can learn at your own pace. If you're seeing a therapist, the material should be familiar to any who practice validated therapies, so you can use it to support your work between sessions. The material in the programs is divided into sections. Each represents a typical week of homework associated with learning a particular skill or method. So, for example, the exposure-based program you're seeing here might take several weeks to complete. The number to the right of each section tells you how many lessons it contains. Sometimes I call these segments, since they're part of a greater whole. Each section usually contains audio and video recordings that frame issues and explore core concepts. There are lots of multimedia presentations to walk you through methods and offer instructions. Scattered throughout the material, you'll also find descriptions that draw from our 3D brain model, so that you get an inside view of how events translate into mental processes. Plus, we put a library of handouts, monitors, and worksheets at your fingertips, all of which are downloadable PDFs. These can be really helpful when it comes to putting what you've learned into action. In some cases, such as with the Exposure-Based Methods program, the sections are only loosely related, so you can go through them one by one or focus on just the ones that apply to your own situation. Most, like changing the way you think, have a distinct progression from one section to the next, so they work best when completed in the order they appear. We're adding to the selections regularly, so the library of resources is constantly growing. Use the toolkit to inspire your own self-help efforts or to supplement sessions with a doctor or therapist. You'll find that it's a great source of ideas and information that will help demystify what effective therapy is all about and make the concepts more accessible for you to use in your everyday life.